Okay. So, normal vital signs. Please note the following parameters are given by a prescribing physician and report findings to the director of nurses or your administrator for further instructions. Um, we, as MedTechs, are not LVNs, we're not RNs, but however, sometimes medications will come with a parameter. It's really important before given medication that we discuss it with the physician if it's outside of the written orders. So, a person's temperature, um, blood pressure, and respirations will be used within a 24-hour period. For medications, sometimes the orders say to take a vital prior to the medication, after medication, but typically we're doing vitals about once every 24 hours. Temperatures 98.6 is the normal oral, 98.8.6 is usually for tempatic, sorry. Rectal is usually a degree higher, and axillary is going to be a degree lower. Ideal blood pressure is 120/80. Respirations are 16 through 23, and pulse rate is 60 to 100 with our pulse rates. Bear in mind, if a pulse is above 100, have the resident rest. A lot of times they could just came back from the bathroom. They could have just changed positions in bed. So retake that pulse if it's higher. When it comes to our oxygen saturations, which I just realized I forgot to put on that slide, when we are dealing with somebody who is on oxygen, please note if you take somebody's pulse ox, oxygen saturation with the finger, and let's pretend it says it is 89. You do not, I repeat, you do not change that oxygen setting. Oxygen is a medication. And a lot of our seniors have what is called COPD. And COPD, the way our body processes oxygen and carbon dioxide is much different chemistry in these individuals. And when we give them more oxygen, we are putting them at risk of actually becoming less oxygenated. And so, for example, when I worked on the floor as a respiratory therapist, I had a nurse one time call me frantic. And she had a patient who was on 2 liters nasal cannula, and that's in the nose. And her patient had went from a 96 to a 92. So she bumped him up to 4 liters, which was okay. But then he went from a 92 to an 89% room, our oxygen level. And so she goes and gets a mask and she cranks him up to about a 7 or 8 oxygen liter. And now his oxygen saturation's dropped even more, and she's calling me and she's panicking. She's a new nurse, but what she didn't realize was the body didn't have enough time to process this oxygen, and it was actually causing the cells to hold on to the carbon dioxide a lot longer. And so an attempt of what she thought was doing some good was actually causing some harm. So please, I just cannot stress this enough, you guys. Don't touch the oxygen. Call the hospice company, call the home health company. Have the nurse come out and assess and have her or him adjust that medication, which is in this case the oxygen. Please don't ever feel like you're assisting them by upping their oxygen levels. Unless there is a written order, you are to not touch that oxygen. All right. Some residents may have parameters for certain medications, such as blood pressure medications. You can assist the resident by applying the blood pressure cuff. Be sure the cuff is applied correctly. So there is a little spot that says artery over here, as shown in the video. And you're going to instruct the resident to push the button themselves. You're going to review the MAR with the resident and give the medication as ordered. So with these parameters, we are not interpreting them, but we're assisting the resident in interpretation of the medication order. Because once again, we're not clinicians, right? And we cannot read an order with a parameter, but we can assist the resident in making sure they read the right parameter for themselves. Some medications may be held based upon a blood pressure reading. If this happens, you need to do a communication, MedTech communication, and send this into the physician and inform them of medication being held and why. Be sure to document the blood pressure log and the reading, and if the medication was held or not. If a resident is nonverbal, contact the director of nurses, the administrator, or your clinical liaison after blood pressure reading to give the directions and on how to proceed with the order. If the resident is reporting being dizzy, shortness of breath, chest pain, swelling of ankles, call 911 and send the resident out for a medication and medical evaluation. Many of these symptoms are indications of serious health changes and conditions and may require medical attention. So, when it comes to cardiac issues, a lot of times one of the first warning signs is going to be extreme swelling in our extremities, especially the feet. And what happens is the heart has a hard time pumping the blood back up through the body. And so because of gravity, it will pull in the ankles and the feet. So if you notice that your resident, especially a resident who's on any cardiac or blood pressure medications, has extreme swelling in their extremities, it is very important you seek medical attention for them. All right, video time. So if you've gone through the caregiver training, you've already seen this video on how to wash your hands, but it's always good to review. So I hope you all, in between your residents, if you're passing out meds, you've got your hand sanitizer and you're pumping the hand sanitizer, you're changing your gloves when appropriate. And when you're washing your hands, we're singing that ABC song. I know you guys all probably thought it was a little corny when I did it the first time, but we're going to sing A, B, C, D on top of our hand. We're going to go to other side, you know, and you're going to get the wrists, LMNOP, right? And you're going to get your fingernails and your beds in between all, right? And you're going to sing it all the way to Z, okay? And then you're going to rinse really good, right? You're going to use a paper towel, turn off the faucet, and you're going to use a dry paper towel to turn off that faucet, not the paper towel that you just used to dry your hands off with. So with no further ado, hand washing.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I want to demonstrate how to perform hand hygiene by using soap and water. There are two ways a nurse can perform hand hygiene. One way is through using soap and water, and another way is through using an alcohol-based hand rub. So when do you want to perform hand hygiene? You would always want to perform hand hygiene before and after patient care, after coming into contact with like a body fluid or an open wound, or touching something close to the patient like a bedside table, the hand railing on the bed, or after removing your gloves, before eating, and after using the bathroom. Now, when would you use soap and water versus the alcohol-based hand rubs? Well, according to CDC.gov's guidelines, you would use soap and water when your hands are visibly dirty, after known or suspected exposure to Clostridium difficile, which is C. diff, if your facility is experiencing an outbreak or higher endemic rates, after known or suspected exposure to patients with infectious diarrhea during norovirus outbreaks, if exposure to Bacillus anthracis is suspected or proven, which is anthrax, before eating and after using a restroom. So now I want to demonstrate how to perform hand hygiene using soap and water. So first, you need your supplies. Of course, you need soap, you need some paper towels, and you need running water. Now, faucets vary depending on where you work. Some are automated. You just have to swipe your hand underneath, the water will come on, or you use a pedal. Or it has little faucet handles that you have to use to turn on and off. Now, generally, it's best not to wear jewelry during patient care because that jewelry can harbor germs. In some areas in the hospital, like surgery, for instance, actually prohibits a person from wearing jewelry altogether. But usually on some units, you can wear like a simple wedding band. So if you do wear a wedding band and you're wearing it during patient care, you need to keep that wedding band on whenever you're performing hand hygiene because you want to clean it, because underneath that ring it can harbor germs as well. So first, what we're going to do is we're going to turn on our water, and we want our water to be warm, not too hot, because if it's too hot, that can dry out the skin and that can cause you to get cracks in your skin, be really uncomfortable for you. So make sure it's warm, and you want to be careful not to let your scrubs or anything like that touch the inside of the sink because it's very dirty and you'll become contaminated. So once your water is warm, you want to wet your wrists and your hands, and be sure you have your hands lower than your elbows because we don't want the germs that are already on our dirty hands to travel up our arms. After you've wet your hands, you want to put the soap on your hands, and you're going to put about 1 teaspoon of soap, which equals about 5 milliliters. And a lot of soap dispensers are automated and they give you the amount of soap you need. So we're going to take that soap and we're going to lather our hands and our wrist with the soap. Now we want to scrub. And what we're going to do is we're going to scrub the soap on our hands using circular motions because this is going to help remove those germs and the things that are sticking to our hands. And we want to cover all the areas of our hands, especially those small crevices, because that's where bacteria likes to hide. We're going to do this for 20 seconds. So first, we're going to go and scrub our palms of our hands. Notice I'm doing a circular motion. Then we're going to get the back of our hands and do both using those circular motions. Then we're going to do our thumbs, and we're going to do each finger individually, making sure we are getting around the fingernail area as well. And then you want to get those knuckles. So really rub the knuckles up against your opposite hand. It's also going to get the outside of that fingernail as well. Then we want to get in between our fingers because, again, germs love to hide in little crevices that are hard to get to. So we're going to make sure we get that. Then we're going to pay attention to our fingernails. And we're going to take our hand, we're going to go to the opposite hand, and we're going to just get underneath the fingernail right in there, just scrape around, remove any germs that could be underneath those fingernails. Then what we're going to do is we're going to get our wrists and go about 1 inch above the wrist as well. Now we are ready to rinse the soap off. So we're just going to put our hands underneath the water and let the water go downward. We don't want it to go upward. Rinsing all of the soap off from the wrist down to the fingertips. Once you get them rinsed, you want to take your paper towel and you're just going to pat your hands dry. You don't want to scrub your hands with this paper towel because that can damage that top layer of skin. And we're going to discard this wet paper towel. Then we're going to grab a dry paper towel and turn off our faucet, and being careful not to touch the faucet with our clean hands. And then we're going to discard this as well. Now, we wouldn't have used our wet paper towel to turn off the faucet because the germs that are on the outside of the faucet could have transferred through that wet paper towel and got onto our hands and undone the job of what we just done with cleaning our hands. Okay, so that wraps up this video on how to perform hand hygiene using soap and water. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.
So infection control is everybody's responsibility. It doesn't matter if you are activities, if you're a caregiver, if you're an administrator, if you're a visitor, if you're the resident, if you're the MedTech. Infection control is everybody's responsibility. The single most effective thing that we can do to safeguard the health of yourself and others is hand washing. You may use alcohol-based sanitizer in place of water, except for C. diff, MRSA, and I also forgot to put on here norovirus. Those bacterias are not effective when it comes to the hand sanitizers. You have to wash your hands. You have to wash your hands thoroughly, and you have to sing the ABC song to make sure that you've gotten the effective amount of time for the hand washing. You should also be gowning up and stuff when you're going into these residents' rooms. Usually when a resident has any of these types of infections, they are going to go out for treatment, but every once in a while, the doctor may deem that it's a low or controlled enough to keep them with us. You must wash your hands before giving medications and after the medications, or use hand sanitizer. You wash your hands anytime you're in contact with bodily fluid. That includes even helping somebody blow their nose. Please wash your hands. Don't use hand sanitizer in this instance. You wash your hands. Wash your hands for at least 30 seconds and make sure they are dried very well. All right. So we are at another point in time where we are going to do a quiz. No, the quiz is just to see how you are doing, to make sure that everything is well. And if you have any questions, please be sure that you speak to somebody on staff and get those questions answered. Here we go. Okay, we are back after that quiz. I hope you're feeling confident in what you're learning here today. We are going to go into glucose testing.
In this video, we'll walk you through setting up and using your AccuCheck Guide blood glucose meter. Now, if you're worried about learning the steps involved, don't be. This video is divided into small sections, so if you miss anything, you can always go back and watch that part again. Now, the first thing to do is to make sure that you have everything you need to start testing. You should have the following items: an AccuCheck Guide meter, an AccuCheck Guide Smart Pack with test strips, an AccuCheck Soft Clicks lancing device, and an AccuCheck Soft Clicks lancet. If you can't find something, or if you need assistance with any of the steps that follow, just contact AccuCheck Customer Care. Next, let's walk through setting up and using the AccuCheck Soft Clicks lancing device. First, you will need to load your lancing device. For this, you will need an AccuCheck Soft Clicks lancet. Remove the cap from the lancing device. Now insert the lancet into the lancet holder as shown. Push it all the way in until it clicks in place. Twist and remove the protective cap from the lancet to expose the needle. Place the cap back on your lancing device. Be sure to align the notch on the cap with the mark as shown. The next step is to set the penetration depth to match your individual skin type. By turning the dial on the cap, you can select the depth of the lancet. Set the dial to 2 to begin with. You may need to adjust the setting a couple of times until you find the right level for your skin type. To use the lancing device, you first need to prime it. Press the priming button all the way down. The release button on the side of the lancing device has now turned yellow. This indicates that your lancing device is now primed and ready to use. Press the yellow button to release the lancet. This will lance your finger. This part is important. AccuCheck SoftClicks lancets are disposable and should only be used one time. A reused lancet is no longer sterile, will lose its sharpness, and become more painful each time you lance your finger. When disposing of a lancet, always make sure that it cannot cause injury and always use a sharps container. To dispose of the lancet, remove the cap from the lancing device. To remove the used lancet, point the lancing device into the sharps container and eject the lancet by sliding the ejector forward, then put the cap back on the lancing device. Now you're ready to do a test. First, you'll need to choose a finger to take a sample from. It's best to alternate between fingers as they can become sensitive over time. Remember to always wash your hands with warm, soapy water and dry them thoroughly. Take a test strip from the Smart Pack, the spill-resistant test strip vial, and always remember to close the lid tightly. This helps protect the remaining strips. Insert a fresh test strip, metallic end first, into the meter, and the meter will turn on. Notice that the test strip port light allows for easier use in darker environments. Now it's time to use the lancing device. Place the pinhole opening firmly against your finger and press the yellow release button. This will lance your finger. Massage the finger in the direction of the fingertip to help the blood drop form. Touch the yellow edge of the test strip to the blood drop. When enough blood has filled the strip, Analyzing appears on the display. Remove your finger from the strip. A small hourglass symbol will rotate on the screen to show you that the meter is working. Your blood sugar reading will be ready in less than 4 seconds. It's just that easy. And now you have your test result. The meter can automatically display your previous result too, so you can compare blood glucose levels. This feature may be turned on in the settings menu. One important final step: dispose of the used test strip by pressing the strip ejector button on the right side of the AccuCheck guide meter. Then put everything in the carry case. You'll find more information in the user's manual that came with your meter. If you still have any questions, please visit accucheck.ca. Thanks again for choosing the AccuCheck Guide Blood Glucose Monitoring System.
So, the number one thing to remember when it comes to glucose testing is that we are assisting the resident with their diabetic care. And what this means is that you should never be the one to physically poke a resident. You could do what is called a handover, a hand method technique, but they should be able to perform these tasks fairly independently with maybe some general oversight. The first step is that you're going to wash your hand and sanitize your hands before beginning the task. You're going to locate the equipment in the med cart that belongs to that resident. Do not use equipment intended for others. Sometimes there are some of our residents that are on telehealth programs. And so if you used a glucose monitor that was intended for Mr. Allen and Mrs. Smith uses it and she has a very abnormal reading, that could affect the care for Mr. Allen because that it's automatically Bluetooth transmitted the physician for review. So please be careful of the equipment and make sure we're using the correct equipment. Um, Help the resident warm their hands if necessary. Use the alcohol wipe on the finger to make sure that the finger is very well sanitized. Apply the gloves and assemble the glucose monitor, the poker, ensuring a fresh needle is used every time, and when it is done, and that it's disposed in the sharps container. Do not dispose the sharp in the med destruction bin. Do not dispose medications in the sharps container. Okay, it's really important that we keep those two separate. Have the resident use the poker, disregard the first squeeze of blood, and then wipe the finger with an alcohol pad, and then squeeze a new amount of blood to be used on the monitor. Have the resident place the drop onto the test strip, wait for the reading, and record it into the resident's file. We should be keeping a glucose log, even if they're on a telephonic system, because sometimes the equipment can fail. So you should be, applying in the log the date, the time, the reading, if there was any medications to be given or held, and then your initials or your name so we know who did the reading. Have the resident wipe their finger, hold the gauze to stop the bleeding, and dispose of any bloody gauze into that sharps container. That is one thing that can go into the sharps container, is anything that is biohazard that has any bodily fluids on it. If the resident has insulin orders, this is where you're going to refer to the MAR for additional steps. Once again, if they're on a sliding scale, the resident needs to be able to help you interpret what dosage of medication they should be getting. You should also contact your clinical liaison or your director of nursing if you're at a location that happens to have a LVN on staff for further instructions. You should also be informing the administrator if the insulin reading, or sorry, not insulin reading, the glucose reading is very abnormal, for additional steps as well. Okay, so the next video is going to be on how to set up and use an insulin pen. Please note, if a resident is admitted or comes back from a primary physician or a physician's office with a vial of medications for insulin, that you have to inform them right away that we need insulin pens. Insulin vials require a special skill set that we are not licensed underneath the state of California to perform. And we don't always have an LVN available 7 days a week if you're at one of the locations with an LVN. So it is really important that we use insulin pens only. And this video is going to show you how to set up and administer insulin through an insulin pen.
Hi, I'm Dr. Emily Walker, a VA pharmacist, and I would like to discuss with you the proper way to give yourself insulin using an insulin pen. There are many different types of insulin pens available from the VA. In this video, I will be demonstrating one specific type of insulin pen called the Flex pen. Other names of insulin pens prescribed by your provider may include Flex Touch, Solostar, or Quick Pen. What is important for you to know is that the correct technique that I will show you in this video is very similar to what you would use for any of the other insulin pens mentioned. Remember, what insulin to use, how much to give, and when to give yourself the insulin will be told to you by your VA provider. Let's get started. When you're preparing to give yourself insulin, you want to make sure that you place all the proper supplies on a flat surface ready to go. These supplies include your insulin flex pen or whatever insulin pen you may be using, your pen needles, an alcohol swab, and a sharps container. If you do not have a sharps container, you can use a heavy plastic container such as an old laundry detergent bottle and write used needles on the side with a permanent marker. Before injecting yourself, wash your hands with soap and water. When your hands are dry, pull off the pen cap from the insulin pen and set it aside. Next, inspect the insulin through the viewing window. Do not use the insulin if you notice a change in color or if you notice things floating in the insulin. By inspecting the insulin pen, you will also be double checking that you have the correct type of insulin. As I mentioned already, for our example today, I'm using the Novolog Flex pen, which has been pre-filled with insulin aspart. After inspecting the insulin pen, put it down and open an alcohol swab. Wipe the rubber stopper on the end of the insulin pen with the swab. Allow the rubber stopper to air dry completely. Do not blow on the rubber stopper to dry it, as this will introduce germs from your mouth. Next, pick up the pen needle and remove the protective paper covering. Grasp the base of the pen needle and carefully screw the pen needle onto the insulin pen. Make sure the pen needle is screwed on straight and hand tightened so that it pierces the rubber stopper completely. Make sure you do not over-tighten the pen needle, as the pen needle base is plastic and can crack. Next, pull off the clear plastic outer needle cap. You will see a second inner needle cap still covering the needle. Remove the inner plastic needle cap. Both plastic caps can be disposed of in your regular household trash. It is important to always use a new pen needle for each injection to reduce the risk of infection. Never reuse or share needles with your family or friends. Next, we will complete an air shot with the insulin pen, which should be done before each injection. An air shot is sometimes called priming. Doing so removes any air that is trapped in the needle. Turn the dial up to 2 units. Hold your insulin pen with the pen needle pointing straight up and lightly tap the insulin pen with your finger a few times to make sure any air bubbles move to the top. Next, press the push button all the way in. The dial should return to 0. You should see a drop of insulin appear at the tip of the pen needle. If the drop does not appear, repeat the process. This can be repeated up to 6 times. If it still does not work, try using a new pen needle. If that doesn't work, then try a new insulin pen. Next, select your insulin dose. Check to make sure the dial is set to 0, then turn the dial selector to the desired number of units. The pointer arrow should line up with your desired dose. The dose can be corrected up or down by turning the dial. For example, if you are prescribed insulin aspart 10 units before meals, you will dial up to 10 in the pen window while making sure the arrow lines up with the desired number of units. Be careful not to press the push button while selecting your dose, or the insulin will come out prematurely. You will hear a click for each unit you dial. It is not recommended that you attempt to dose based on how many clicks you hear, as this may result in an incorrect dose. Please note, towards the end of the insulin pen use, you will not be able to dial more than the number of units remaining in the insulin pen. Next, if your skin is not clean, use an alcohol swab to clean the site before injection. If you just bathed, you may not need to clean the area with alcohol. Remember, alcohol can be very drying to your skin, so you don't want to apply alcohol to your skin if not needed. Insulin can be injected into either your abdomen or stomach area, buttocks, on the high hip upper outer area, thigh, or upper arm. That is the back, fattier part of your upper arm, and not the muscle area. The needle you are using is thin and may bend. You may find that pinching your skin gently before injection can prevent bruising and decrease the chance of bending the needle. It is recommended that you rotate to different sites each time you use the insulin pen. If you plan to be physically active right after the injection, it is recommended to rotate around your stomach area only, rather than to the arms, legs, or buttocks. Avoid injecting insulin into any area of skin that has pits, is thickened, or has lumps. Avoid injecting where the skin is tender, bruised, scaly, or hard. In addition, stay 1 to 2 inches away from your belly button, scars, or skin with open wounds. If you are injecting more than one type of insulin, use different injection sites, as the insulins won't work as intended if injected in the same site together. For instance, give your basal or long-acting insulin on the left side of your stomach, and then give your bolus or rapid-acting insulin on the right side of your stomach. Insert the insulin pen into your skin straight in and not angled. Again, if there is not enough fatty tissue, pinch a 1 to 2 inch portion of skin in fat. Once the insulin pen needle is inserted into your skin, keep it in place and press the push button on the insulin pen all the way in, and maintain it pressed until the arrow next to the dial returns to 0. Keep it pressed for a full 6 seconds after the dial is at 0 to make sure all the insulin is injected. Now you can remove the insulin pen. A small drop of insulin may appear at the end of the needle. This is normal and can be expected. If a drop of blood appears on your skin after you remove the insulin pen, press the injection site lightly with a gauze pad. Do not rub the area. Once the injection is completed, do not recap the needle, as this can cause an accidental needle stick injury. Remove the pen needle from the insulin pen by grasping the sides of the plastic hub and twisting. Discard the pen needle into the sharps container. Place the pen cap back on and store the insulin pen in a safe location. Your insulin pen can be stored at room temperature, below 86 degrees Fahrenheit, for up to 28 days, away from heat or light. It is recommended that you keep your unused insulin pens in the refrigerator between 36 to 46 degrees Fahrenheit, as the insulin pens can be safely stored until the expiration date on the label. Never freeze insulin. When the insulin pen has been completely used up, it will not allow you to give any additional doses. At that time, you can discard your insulin pen with the pen needle removed into your household trash. The pen needles should always be placed into a sharps container. You have successfully given yourself a dose of insulin using an insulin pen. Good job! I thank you for your service to our country, and I'm honored to be of service to you this day.
How to assist a diabetic resident. So how to direct and guide a diabetic resident to perform blood glucose checks and insulin administration. So we are going to, use hand sanitizer again. You shouldn't, if you're, assisting the same resident, you shouldn't have to go and wash your hands, okay? Check your MAR, triple check time, order the directions on the pen and your MAR, okay? You're going to hand an alcohol wipe to the resident, and they are going to clean the site for the injection. Don't forget, you're going to have to express any error in the insulin pen. So you're going to do a click or two, remove the error, and then you're going to re-click it to the appropriate unit dosage amount. And you're going to actually encourage the resident to do the pin clicking themselves. They might need you to watch the window and make sure that they have, 5 units and not 15 units on the little window for the pin. And you're going to have the resident poke themselves. If they have difficulty in pushing the stopper, the button on the end of the pen, you can assist with a hand over hand to push the plunger down, but they really should be engaging in this on their own. Take the bigger cat. So the resident's going to remove the pen out of their area that they've injected. And you're going to take that bigger cap and you're going to put it over that needle. And then you're going to twist it off to dispose into the sharps container. Okay, so next we're going to go into a video with the different types of insulin and why we give them and how we give them. It's really important that you understand this because some insulins require at bedtime, some insulins require before meals, some insulins required after meals, and it's all based upon their mechanism of how they work. And it's really important that you understand that when you have a resident who is a diabetic, that you never go rogue on your own and decide to give them insulin outside of an order or an order set. The reason being is not all insulins are created equal. So you could be giving somebody a long-term acting insulin thinking it's going to be a short-term acting insulin and it's going to take effect immediately. And in reality is that you can cause a diabetic crisis 12 hours from now because you have given them too much of the wrong medication. So please watch this video. How to help the resident with their insulin is a very key part of being a med tech. So make sure you explain to the resident, why they're on insulin and things that they can do to help maybe reduce the need of so much insulin, like switching from a sugar in their coffee to maybe a Splenda or Equal in the morning. Okay. There are many different types of insulin. It's important to know what you're giving your resident when they receive it. Some insulins are once a day, some are just before meals, and they can act very fast on the resident system. It is extremely important that you do not give, that you understand that you only give insulins as ordered and when ordered, and that you do not give them outside of these ordered times. Even if your residents' glucose levels are high, I cannot express this enough. Do not go on your own and decide to give something because you think you're helping, because you could be causing harm. If a resident only receives insulin once a day and glucoses are higher at dinner time, do not give without a written order. So you might call the physician and let them know that, hey, Mr. Smith's glucose was really high, and Mr. Smith's doctor might recommend that you give 10 units of insulin. But however, do not give that insulin without that order, because you might have heard 10 and he said 1. A normal glucose level is less than 140 and no less than 75. Some providers will establish different levels for each resident. So it's really important to know what the doctor's recommendation is for that resident. Anything above 250 needs to be reported to a LVN if you have one on site, the physician, and document in the resident's files. It's really important to understand that if you have a resident who is frequently has sugars that are above 250, that you have a conversation with the doctor about making medication adjustments. And if you feel like you're not really getting anywhere with the physician, it's really important that you have a conversation with the administrator or the LVN, so they can also have a conversation with the physician and or pharmacist, or the potentially the family member, if they need to get the family member involved to make medication adjustments. It's also really important that if you have a resident whose blood sugars are extremely low and you cannot get their glucose levels up with some juice or something, that they get sent out to the hospital immediately. And the same thing with high blood glucose levels. If somebody's over 350, we really should be calling 911 and asking them to be taken in for a medical evaluation, unless there's an order set that says differently. Many times, the physicians might not realize what's going on if we don't communicate. Sometimes residents might return back from an appointment with a vial. As mentioned before, we cannot have vials in the ALF setting or memory care. So it's really important that we get an order for a pen. If the medication cannot be switched out for some reason, we might have to look for placement elsewhere. Okay, so the next video is going to be on how to recognize high blood glucose levels and low glucose levels in our diabetic residents, and how we could potentially assist. How to assist a resident in a diabetic crisis and how to recognize these. So, as a med tech, it is extremely important to recognize signs and symptoms of any health conditions, but in particular, blood glucose levels are very critical for a healthy life, and being too low or being too high can be life threatening. So, the common high level symptoms are increased thirst, dry mouth, increased hunger, frequent need to urinate, feeling lethargic, and blurred vision. So if you have a resident who maybe hasn't been diagnosed as a diabetic yet, but you're seeing these symptoms, it is very important that you bring this up to the physician and you bring this up to your LVN or your administrator, so that way we can have conversations with the physician about getting maybe some diabetic testing going on to see if they are potentially a diabetic and how we can assess that resident. The most common low symptoms are increased heart rate, strong sense of hunger. They're going to be very weak. They may be very clumsy, increased confusion, dizziness, and difficulty in concentrating. Um, and these low symptoms of low glucose levels can be a little hard to detect sometimes, especially in our memory care residents. But if this is an ongoing issue in somebody who's not a diabetic, and it's brand new, even if they have a diagnosis of dementia, please bring this up to the physician ASAP, so that way we can also get them tested. All right, so the next video is going to be on sharps containers. It is extremely important to assess diabetics and their care, that you take steps to protect them and yourselves from accidental needle pokes. If a needle poke occurs and it was a resident's needle, you need to inform your supervisor right away. There are going to be things that you're going to need to do in order to protect your health. Never recap a needle. You'll see that sometimes nurses will do, like they call it the one scoop method, where they, kind of scoop the needle cap up and then they'll cap it. Never ever do that. Just throw a needle into the sharps container. With the insulin pens, those caps are fairly resistant. And if you're turning them in the right position, you are safe from a needle poke. If you try to uncap it, though, however, without that cap, that protective cap being put back on, you are risking yourself at a needle poke, okay? Never keep them in your pockets. I know sometimes we like to keep extra supplies in our pockets in case we need when we walk into a room or something. But you're putting yourself at a risk. And never ever force a sharp into a sharps container if it is full. You are better just to put it into an empty container on the side and then put the contents of that container into a new sharps container. Never force open a sharps container. And if your sharps container is full and you cannot locate a new one, notify your supervisor immediately. So we're going to go into preparing the med cart. So this is the typical medication cart that you will see in a variety of care settings. You'll notice they've got plenty of cups and straws. They've got their water ready to go. They've got their MAR on top. And they've got a clean service for medication preparation with a little paper towel there. So you should check your medication cart to the prior of the start of your shift. And so what this means is you shouldn't be arriving exactly on time for your shift. Come 5-10 minutes before, start looking at your cart. Make sure you've got plenty of cups and all the necessarily supplies that you're going to need. And this includes a fresh, a pitcher of water, spoons and medication cups, applesauce and yogurts, tissues, and your medications crushing device. You should have a medication drug book handy. And the reason is maybe there's a new medication and Mrs. Smith is going to ask you about it. So it's really important to, be prepared for questions that the resident might have. And if you don't know an answer to a question, please don't just say anything that you think sounds appropriate. The best answer is, I don't know, but let me find out and I'll get back to you. And that's when you contact the supervisor. So your MAR, do not use your own individual notepad to write down medications and use that in replace of your MAR. I've seen MedTechs do this, and it is absolutely not appropriate. If you're going to take one or two medications with you, take the whole MAR book or take that MAR sheet with you. Do not use your own notebook for the purposes of administering medication.
First, you're going to have a lock that looks like this. It's very easy to put in and take out. They're on the larger side of the locks. I'm sure Dave is going to have a process for all that. But the locking system is very easy, just like that. That is, and then it unlocks. The keys can just stay in that. And of course, we can't have meds unattended. We also have to have this locked when we aren't by it, so it has to be locked when unattended. When you look at the structure of it, there's a big surface area. You can see the MAR books are the same in all the towns, and there's a lot of space when you look at that. These MARs, of course, have that little bit of rubber on there, so when you're backing it against a wall, that they'll stay up easily when you're doing your med pass. There are 3 drawers on the smaller side on the left, and then the 3 larger drawers on the right. It is locked and secured with these locks here. Very easy to push them, and you will be able to lock it, and it becomes not obviously very mobile at all. And there is a lock on this one back here that you can lock as well. However, when those locks are not engaged, this is a very easy, I can even pull it and push it with one hand. So it's very mobile. The drawers are of large capacity. Oh, one more thing I wanted to show you, I'm sorry. There is a pull-out drawer, and that pull-out drawer can be utilized during your med pass, and it can handle up to 20 pounds. And so we don't want to break that or put anything else on there, but that is the way the pull-out drawer looks. So again, these drawers can be utilized per home, specific to what you guys want. The nursing team will be available for managers and queues to talk, and people supported to talk about what this looks like, how they want to store the items in their home, because each house is going to be a little different. So I have a variety of things here to show you. So in the first drawer, I just wanted to say there is a booklet here, product catalog. When you think about the things that you need in a med pass, I'll tell you, it looks nice to have that paper towel there, but the paper towel, it doesn't shut. So we'll have to have something for that. Even the paper towel can just, hang right here and be utilized. Also, this does sit straight up. The Clorox wipe does, because of course you have to clean it before and after each use. This is high quality. It can be sprayed with antibacterial spray, or a Clorox wipe can be used between uses. Of course, internal and external meds have to be stored separately. That is for sure what we need to have. This is not really a nebulizer, but it is a box, and that just shows you the size of items that can be in there. And this is just an acrylic tray that I had, and they're able to be in there. There are some hooks here that I suppose if you got real creative, but that is a very deep drawer. And if I didn't say it, internal meds and external meds do have to be stored separately. So I'm thinking these could be the places where you have that storage. I have a little basket in my office, and so I put it on there, and that basket is utilized. Might be something that people are interested in doing. It certainly could be when it comes down to whatever drawer. Maybe this is where the pens and the cups go. I mean, there's a lot of things that you can do. Again, it's going to be specific to your house. And of course, a lockbox for controlled substances. They're sitting there very easily. When we open these big, large drawers, again, you don't have to set it up this way, but I do have that large container here, and I have med cups, if you can see them, and water glasses, and of course, it's just a plastic tray. I also have what we commonly see on people's desks, and just so that you know the size, that will hold it. And of course, we could have paper clips or alcohol swabs, whatever that person supported would need, or whatever the staff need to handle meds. And of course, these drawers are so deep, I don't necessarily have dimensions, but it is easily seen how these plastic containers easily fit in there, and they fit depending on how that situation will go. And I don't have anything there. I have put some binders in there, and of course binders fit in there. They stack up nice if you have a start and a stop on there. So these medication carts are going to be implemented as soon as we...
All right, so we are going to go into our next video, which is our metered dose inhalers. And we're going to have another key phrase, and our key phrase is going to be nebulizers. So the key word to make sure that if you're watching this video independently is nebulizers.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to demonstrate for you how to use a metered dose inhaler using both the open mouth and closed mouth technique. So what is a metered dose inhaler? This is an inhaler used to deliver a set amount of medication into the patient's lung. And the medications include like bronchodilators like albuterol, a brand name for that is like Ventolin or ProAir, along with corticosteroids such as fluticasone, which is known as Flovent. And patients who have respiratory diseases like asthma, COPD may be prescribed these inhalers. Now, these inhalers can also be used and be ordered as a combination where there's one inhaler, but there's two different types of drugs in them, like Symbicort, which would contain a bronchodilator and a corticosteroid. So you want to keep that in mind and always look at what your patient's going to be taking. Another thing is that you want to teach the patient proper technique when using these inhalers, because if they don't use them correctly, what will happen is that not a lot of the medication will get down into their lungs. It'll just stay in their mouth. And that is a big issue with some of these medications like corticosteroids. So whenever you are teaching the patient how to use an inhaler, try to get a spacer. This is what it looks like. And it attaches onto the inhaler and they inhale through that, which I will be demonstrating in the next video how to use. But if a spacer is not available, you can use the open or closed mouth technique, and always go by whatever the physician has prescribed for the patient. A lot of the patients will tell you what they've been using, and you need to make sure that they're doing it right. Now, why would you want to use a spacer? Well, the spacer is going to be easier to use than that open mouth, closed mouth technique, because whenever you're using this inhaler, with those techniques, you have to simultaneously press the inhaler down and inhale at the same time, which takes a lot of practice. So if you have a really young patient or a patient who's older who has issues with holding the inhaler, that can be troublesome. Also, the inhaler in the chamber is going to allow this, in a sense, lead time for them to inhale the inhaler substance, so they don't have to press it down simultaneously, and it's going to decrease the amount of medication that's going to be left in the mouth, which with corticosteroids we don't want that because it can cause mouth irritation like thrush. So what we're going to do first is we're going to perform hand hygiene, and we're going to perform the patient's 5 rights. We're going to make sure that we have the right patient, the right drug, the right dose, we're doing it at the right time, and the right route. And you always want to look at what you're giving, because whenever you're doing these inhalers, there's some things you want to keep in mind. Okay, say you were going to be giving a bronchodilator inhaler and a corticosteroid inhaler. So you have two inhalers. It's very important you know which one you need to give first. The first one you want to give is the bronchodilator because it's going to open up those lungs and dilate that. Then you need to wait 5 minutes and then administer the corticosteroid because then the corticosteroid can get in there and do its job by decreasing the inflammation. Now, say you were giving 2 puffs of a bronchodilator and that was it, or 2 puffs of the corticosteroids and that was it. You would first do a puff of the bronchodilator and say they need another bronchodilator puff. You would wait 1 minute and then give the other one. So if you're giving the same medication, just 2 different doses, you're going to wait 1 minute. But if you were going to give a bronchodilator, then a corticosteroid, you would wait 5 minutes because we need 5 minutes for the bronchodilator to do its job. And then another thing you need to remember is that after the patient uses the inhaler after doing a corticosteroid, they need to rinse, they need to gargle and rinse their mouth with water and then spit that water out. Because the corticosteroid, whenever it comes into contact with those mucous membranes in the mouth, it can cause thrush. So it's very important you get your patient to do that. Next, what you want to do is you want to prime the inhaler. So you're going to prime the inhaler if it's the first time you're ever using it. If the patient hasn't used it in a week or more, has dropped it, or recently cleaned it. So before you do that, just make sure that your inhaler is in date, it's not expired. So to do that, what you're going to do is you're just going to gently pop this canister off and it will tell you the expiration date. This is 2020, so we're in date. And the dose that we're using, this inhaler that we're using here, is a demo dose. It's a teaching dose. It does not contain medication. Also, never administer medications to a patient if you don't have proper credentials or if you've not been trained, and always follow your hospital protocols. So another thing, whenever you're going to go prime it, you want to check expiration date, but you also want to make sure that there's enough doses in this inhaler because they only contain so many puffs. So a lot of inhalers have a counter on them and it'll tell you how many's left, like 20, 10, however many. So look there to make sure you have enough. And if it doesn't say it, like this one doesn't, the box will tell you how many sprays are in each inhaler. And this one has 200 sprays. So you'll need to pay attention to how many sprays the patient's doing a day and calculate that out. For instance, say that the patient is doing 2 puffs twice a day. So how many puffs is that in a day? 4. And there's only 200 puffs in this box. How many days is this inhaler going to last if they do it every day? Just 50 days. So you want to keep track of that. Now to prime the inhaler, what we're going to do is we're going to remove the cap and then just hold with your thumb at the bottom and your 2 fingers at the top and gently give it a shake. And depending on the manufacturer is how many sprays you're going to spray to prime it, because each inhaler is different. So always read the instructions. With this one, it's 4. So what we're going to do is just do 4 sprays. Now that our inhaler is primed, let me demonstrate for you the open mouth technique. I'm going to tell you about it and then I will show you how to do it. Okay, so what you're going to do is you're going to have your patient set up and you're going to have them hold the inhaler in between their thumb and their 2 fingers and give it a good shake for about 8 to 10 seconds just to mix up that medication really good. Then they're going to measure out 2 fingers width between their mouth and the inhaler and make sure the inhaler is pointed at their mouth. And what they want to do is they want to breathe in and then breathe out through their mouth until they no longer can. And then after that, simultaneously, they want to hit the inhaler down and breathe in slowly through the mouth of the stuff that's coming out of the inhaler. And then they'll want to hold their breath for 10 to 12 seconds and breathe out slowly. If they need another puff of that same medication, they can do it in 1 minute. So let me show you how to do that. Then after that, recap the inhaler, and if it was a corticosteroid, be sure to gargle and rinse the mouth with water and spit, and perform hand hygiene and document. Now let me demonstrate the closed mouth technique. So what you want to do is hold the inhaler in between the thumb and the fingers and give it a good shake for about 8 to 10 seconds to get the medication mixed well. And you'll have the patient take a breath in and then out through their mouth until they can no longer exhale, and then put the mouthpiece of the inhaler in between the teeth, keeping the tongue flat and the lips sealed around it, and they will simultaneously hit the inhaler button and breathe in until they no longer can breathe in, and then hold it for about 10 seconds and then exhale slowly. And that'll look something like this. And after that, recap the inhaler. And again, if they were using a corticosteroid, have the patient gargle and rinse the mouth and spit with water, and perform hand hygiene and document. And if they needed to use the same medication again, when would they do it? They would do it in a minute. But if they were going to be using, say this was a bronchodilator and they needed to use the corticosteroid, how long would they wait? 5 minutes. Okay, so that wraps up this video on how to use a meter dose inhaler using the open and closed mouth technique. Thank you so much for watching, and don't forget to subscribe to our channel for more videos. Hey everyone, this is Sarah with RegisteredNurseRN.com, and in this video I'm going to demonstrate for you how to use a meter dose inhaler with a spacer. Okay, so what is a meter dose inhaler? It is an inhaler that will deliver a set amount of a medication into the lungs. So it's used by people who have respiratory diseases like asthma, COPD. And those medications generally given are like bronchodilators like albuterol, or corticosteroids like fluticasone, which is Flovent. And these medications will help either dilate the lungs, which is a bronchodilator, or corticosteroid, which will help suppress the immune system, decrease that inflammation in the lungs. Now, when using a meter dose inhaler, it is best to use a spacer. Why is that? Well, whenever you're using those open or closed mouth techniques like how I demonstrated in the previous video, those take a lot of dexterity. You have to be able to press the inhaler button down and inhale at the same time. And if you don't do it correctly, a lot of the medication will end up in the mouth and instead of the lungs. But using the spacer helps decrease that because it gives the patient, in a sense, time to hit the button and inhale, and it helps prevent a lot of that medication, especially that corticosteroid, from collecting in the mouth, which can in the end cause thrush. So always try to get one of these for your patients. So let me show you how to actually use it. So the first thing what you want to do, of course, is perform hand hygiene, perform the patient's 5 rides. Make sure you have the right patient, the right drug, the right time, the right route, and the right dose, because you'll be giving these in puffs. So check all that information out. And another thing you want to remember is while you're doing your checkoff is that you want to make sure you know exactly which inhaler to give when. For instance, say you're giving a bronchodilator and a corticosteroid, so the patient has 2 inhalers. Which one would you want to give first? You want to give the bronchodilator first because it's going to dilate out those lungs, and then 5 minutes later you would want to give your corticosteroid so it can go in there, do its job, and decrease inflammation. Also, say that you were just going to be giving 1 inhaler but it required 2 puffs. Well, you would give the 1 dose that they need, the 1 puff, and then 1 minute later you can administer the 2nd puff. So if you're giving the same drug, you would wait a minute. But if you're going to do bronchodilator and then a corticosteroid, you would want to wait 5 minutes. In addition, after giving the corticosteroid, inhaler, you would want the patient to immediately gargle and rinse with water and spit that water out to remove any possible corticosteroids that have collected in the mouth, because if they stay in the mouth, they can irritate those mucous membranes and cause thrush. So first, what you want to do is you want to prime the inhaler, and you'll do that if this is the first time you're using the inhaler, or if it's been dropped, or the patient hasn't used it in a week or more, or if it's been recently cleaned. And while you're in the process of doing that, just check the inhaler, make sure it's not expired. You can do that by popping it off the canister and looking at the date. And this expires in 2020, so we're good. Also, just quickly check to make sure there's enough doses in this inhaler. And of course, if it's new, there is enough doses, but if this has been used before, you just want to make sure that you have enough puffs in here. And a lot of times, the inhaler has a counter on it that you can look at it, or the box will tell you how many doses are in each inhaler. So check that out. In this particular one, there's 200 sprays. So you'll want to count out how many times the patient's going to be using it and how many days that's going to transpire over. For instance, if the patient was going to be using this inhaler 4 times a day, twice in the morning, twice at night, that's 4 puffs, and it has 200 puffs, how many days is that going to last us? 50 days. So you want to keep track of that. So to prime it, what we're going to do is we're going to take the cap off and just check inside the inhaler, make sure there's nothing hanging out in there, because sometimes patients like to keep these in their purse, and some lint and other things can get in there and you don't want them to inhale it. So make sure it's clean, and we're going to give it a good shake. So hold it in between your thumb and your fingers and shake it for about 8 to 10 seconds. Get it mixed up really well. And then we're going to give it 4 sprays. So it's nice and primed. So after priming the inhaler, you're ready to connect the inhaler to the spacer. So make sure that the cap of the inhaler is off, and then take the cap of the spacer off, because this is the mouthpiece where the patient's going to put their mouth at and actually inhale. And then this part right here is where you're going to connect the mouthpiece of the inhaler into the spacer. So just connect it like so, and it stays on. Then have your patient set up, hold the inhaler with the thumb and with the fingers, and then just give it a good shake for 8 to 10 seconds. Then have the patient breathe in through the mouth and then out through the mouth until they can no longer breathe out. They will seal their mouth around this chamber with the in between their teeth, their tongue flat, and then they will press the inhaler down and then inhale. So it's different from those other techniques that we use where they had to simultaneously press it down and inhale. So they press it down, then inhale until they can no longer inhale anymore, and then they'll hold it for about 10 to 12 seconds and then breathe out slowly. And again, they would want to rinse their mouth if they use corticosteroids, and if they have to repeat the dose, they will do that in 1 minute. So now let me show you what that would look like. And after that, of course, you will have the patient rinse their mouth, gargle, and spit water if it was a corticosteroid, and you will recap your inhaler and your spacer, then perform hand hygiene and document. Okay, so that wraps up this video on how to use a meter dose inhaler with a spacer. Thank you.
So there are many different types of inhalers. The video that you're going to see next is going to go over the different types. It's also important to know that if you're going to be giving any of the steroid inhalers, such as an Advar or a Spiriva, that you're going to want to make sure your resident is cleaning their mouth out as well afterwards. So it's really important that you assist residents during a crisis time for their MDIs. Most meter dose inhalers are going to be a scheduled order set, but there are times that you might need to give it as a PRN, which is an as needed order set. And a lot of times when it's as needed, they are very anxiety driven, they are very short of breath. They're going to have a difficult time in coordinating their breath. And so this is when you're going to become that coach, that cheerleader, kind of almost like that Lamaze person, and you're going to assist them in the appropriate breath. So you're going to encourage them to take a nice deep breath in through their nose. And then you're going to let them know that they're going to pretend that as they're exhaling, that they're cooling off some soup. So nice deep breath through the nose. And this is going to help calm down their heart rate. This is going to also help open up the airways. When you're giving the inhaler, it is extremely important that you use an aero chamber, aka also known as a spacer, especially in these times of being extremely short of breath. What is great about a spacer is it's not going to require the resident to have a breath coordination with the pump of the medication. So the nebulizer, it's a continuous neb where they're going to be pushing out the medications. The spacer almost acts like a nebulizer in this sense, meaning that the medication is going to be sitting there in that chamber and is going to be waiting for them to clear it out when their breath is appropriate. So, with a meter dose inhaler, if we take it without the aero chamber, the medication doesn't have enough time to get to the right particle size. But not only that, now you have to make sure you pump and breathe at the same time, which could cause coating in the back of the throat and stuff and cause some medication errors that way. So with the aero chamber, we're going to make sure there's no debris in the aero chamber, and we're going to do the puff. We're going to breathe in through the aero chamber, and it's going to help clear out that medication. And it's going to be 4 breaths. We're going to want it to not sound like a harmonica. It's going to be a nice quiet breath. And that's how we know the medication is being delivered. We're going to wait 1 minute, and then we're going to do another puff and another 4 breaths. If the inhaler has not been used in over 3 days, we're going to do what is called priming the inhaler. And that simply means that we're going to shake it up and we're going to do a puff in the air to help remove the propellant out of the little end piece and make sure the medication's locked and loaded into the inhaler. Um, the aero chamber is the best way to help coordinate all of this.